This is a two-page chart that goes over the parts of Medicare and pretty much answers the questions that most people need to figure out when they're starting Medicare. Really nothing more. This is kind of a cheat sheet. So let's go through this top to bottom on both pages. So Medicare itself is made up of various parts, as you might know. So what are those parts? How do they work together? So I like to think of it, you start from the foundation, just like anything else. The foundation of Medicare is something called original Medicare. Not surprisingly, because that's what Medicare was when it was started in 1965. So original Medicare is two parts, Part A and Part B. The combination of those two creates original Medicare, or the foundation of coverage. Everyone who is fully on Medicare has at least Part A and Part B. And we'll talk a little bit more in a minute about why that's not enough, but that is the foundation. So Part A, that's hospital insurance. So think of it as like room and board at a hospital. So your room, the food, the services of the nurses, that kind of stuff. And it covers inpatient hospital stays, hospice care, some degree of home health care, skilled nursing care for on a limited basis. And then for most people, it is free, or not really free. It's already been paid for. That line item out of your paycheck, every paycheck you've ever earned, that Medicare line, that's what goes to pay for Part A. So if you've worked more than 10 years, or your spouse has, and paid payroll taxes on that, like everyone has, then you get Part A for free. If you don't get Part A for free, you can buy it, but that's a very rare circumstance. So Part B is medical insurance. That's again, these are the terms as defined by Medicare. It doesn't make too much sense, but just go with me. So Part B, medical insurance, that's everything mostly outside hospitals. So like your doctor's office visits. Interestingly enough, it also covers the services of a doctor in a hospital, beyond the room and board, which is Part A. But preventive screenings like your annual physical, preventive services, regular checkups, clinical lab or diagnostic services like blood work, x-rays, MRIs, CT scans, drugs administered by a healthcare professional like infusions, stuff that's not a prescription that you take on a regular basis yourself. This covers ambulance services. And the last kind of big area it covers is durable medical equipment like wheelchairs, crutches, blood sugar meters. And the Part B premium, it is not free. The base premium or standard premium in 2024 is $174.70 a month. And that does go up if you earn more than a certain amount of money every year. So it is not free entirely. Part A is. Part B, everyone has to pay for to some degree. So with all that together, with the exception of prescription drugs, which we'll cover in a second, that's your major medical coverage that you might be used to. That is, pretty much all the services of healthcare professionals that will help you restore or maintain your health. The last thing to mention, which is very important, while all these things are covered by original Medicare, it doesn't mean it's paid for 100% by Medicare, meaning the covered services. Original Medicare, just as an easy way to explain it, covers 80% of those costs. You are on the hook for the other 20%. And the kicker here is there is no limit to that 20%. So $1 million hospital claim, you're on the hook for $200,000. And if you have more and more claims, which does happen, and claims can go into multiple seven figures, you're going to be on the hook for 20% of it with no limit. So not a lot of people, at least that I know, who really are comfortable with that. And I'll show you what to do about that in a second. Part D, and we skipped Part C, but this will come full circle. Doesn't really matter. Part D is the next thing to cover, and that is prescription drug coverage. Believe it or not, when Medicare first rolled out, prescription drug coverage was not included. It was actually not until the early 2000s when that became true. So this is coverage that you need to buy. It's either included in a Medicare Advantage plan or you can buy it separately. There are 4 stages of coverage, at least through the end of 2024. For 2025, it's becoming much simpler, but let's cover how it works now because it's still 2024 as I record this. So the first stage of coverage, that you'll see dollar figures here. This is in terms of cost of drugs. So we're kind of running a tally. The cost for drugs that mostly you pay. So the first $0 or the first $1, I should say, to $545, that's the deductible phase. Some plans have a lower deductible, but the maximum allowable deductible for a plan is $545. You're paying the first $545 for your drugs. And some plans will have co-pays during this phase to where you're only paying $3, $5, $10, $20 for a drug, which is great. But by and large, expect to pay the negotiated retail price for drugs up to that deductible level. The second phase is called the initial coverage phase, where you're going to have not the full price of the drug on as your responsibility, but you're going to have co-pays of say $10, $20, $30, $40, or maybe more, and coinsurance. So just a percentage of the cost is what you'll be responsible for. So that goes up to $5,030 in drug costs, which is a lot. Not a lot of people reach that level, but that's how it works. The third stage of coverage is called the gap or the donut hole, the coverage gap or donut hole, which is that space between $5,030 and $8,000 in total drug cost, where you are on the hook for 25% across the board for drugs. And then once you hit $8,000 in total drug costs for a year, you hit the catastrophic phase, which basically sets you back or takes care of drug costs for you beyond that point. So a little bit complicated. The real way to budget for this and plan for this is doing plan research and just seeing what your drug costs would be under a certain plan. But just to make sure we cover this, that is how Part D works through the end of 2024. Of Medicare, again, we'll touch on Part C here in a second. This is kind of the academic approach, the nuts and bolts. Really, in a practical sense, in the real world, you can kind of forget this and focus more on this second page of the chart, which is the 2 fundamental options you have for coverage. Basically, these are different combinations of those various parts of Medicare, and then it's your choice which one you want to go with. The first option is a Medicare Advantage plan, also known as Part C. So that's where Part C comes in. Again, it's just a naming convention. It doesn't really mean that you have to have C next after A or B. It's just how the plan designers came up with names. It doesn't always make sense. But Medicare Advantage is your first option. Your second option is a Medigap plan with a Part D plan added to it. So there is no right or wrong answer. It totally depends on your circumstances. There are excellent points for and against each. So we're going to go over those and how they work. So the first option, Medicare Advantage. This is lower monthly cost, but a higher cost or higher risk as you use healthcare services. It's more of a pay-as-you-go type system that you're probably used to. It's more akin to how most other under age 65 or non-Medicare health insurance works. These are, let me back up. The behind the scenes of this is you are trading in original Medicare, that Part A and Part B. The government is handing that over to the private insurance company that you choose a Medicare Advantage plan from. That's nothing to get too hung up on, but just want to let you know that those are the mechanics of how it works. These plans are PPOs or HMOs, which means it's in your best interest to stay in the plan's network, and you need to do your diligence to make sure your doctors and preferred hospitals, things like that, are in the network of the plan you're looking at. With PPO plans, just as a refresher, you can go out of network and the plan will still pay, but it's going to be a lot more expensive for you. It's not going to pay quite as much, or I should say, nearly as much as if you stay in network. So you got to stay in network with these plans. It's in your best interest. Mostly your share of costs is going to come via copays and co-insurance. So copays being, that flat 20, 30, $50 to go, see a specialist or your primary care physician, or a flat amount for an x-ray or lab test, something like that. Co-insurance, again, if you're not familiar, is a certain percentage of whatever the bill is that you'd be responsible for. Usually it's 20 to 30%. Medicare Advantage plans are required to cover at least as much as Part A and Part B. All these services that we looked at here, like inpatient hospital stays, hospice care, ambulance services on the Part B side, preventive services, doctor's office visits. And most do include Part D prescription drug benefits as well. So just because they cover these things doesn't mean they pay for them as well, but just something to keep in mind. Again, as we touched on a minute ago, this will be private health insurance, and it'll replace your original Medicare. Just letting you know that's how it works. Dental, vision, and hearing coverage can be included in these plans. It usually is, but it's, with some exceptions, it's kind of middle of the road, mediocre coverage. It's nothing stellar. These plans will often have value added benefits like gym membership, over-the-counter allowances, which is $50 every 3 months or so for you to go buy Band-Aids or aspirin, vitamins, stuff for your health at a drugstore, for example. Premiums for this, as we mentioned, this is low monthly cost for the plan itself. Most Medicare Advantage plans cost $0 per month premium. Some have some amount of premium on them, but by and large, the ones that are competitive, probably the ones you're going to choose among, will be a $0 per month premium. With that in mind, I should say, you still have to pay your Medicare Part B premium, which is that $174.70 as the standard for 2024, but it's nothing extra in many cases to have the Medicare Advantage plan on top of that. $0 deductible. So most of these plans do not have a medical deductible, but instead there are copays and co-insurance. That's the share of what you pay. Out-of-pocket maximum. So this is important. While this sounds great, it's less expensive than the other option we're going to cover in a minute. These plans will have a maximum out-of-pocket for you of up to $8,850 for the year. Basically, what that means, when you add up all the portions of healthcare costs that you're responsible for under one of these plans, that can rack up to almost $9,000 for the year. Once you hit that, the plan pays 100% for every other covered service from then on. But that's a lot of money for 1 year. If you have an unfortunate year, have a lot of treatments, something like that, just know that you're on the hook for up to that amount. Some plans have lower out-of-pocket maximums than that, but they're allowed to have these maximums up to that amount for this year. And that limit raises a little bit or goes up a little bit every year usually. Last point here, these plans are always guaranteed issue, which means you can enroll in one with no health questions asked. Now, you need to do it during the specified enrollment periods, but they can't discriminate based on your health. Whether, if you want the plan and it's the right time to enroll in it, you can do it, no questions asked. Something that is becoming a lot more popular in conjunction with Medicare Advantage plans is critical illness insurance. So coverage for cancer, heart attack, stroke, which are the most common reasons someone might be hospitalized and the most common reasons someone might reach their out-of-pocket maximum and be out several $1,000s. So if you have one of these plans for about $15 a month per $5,000 of coverage, these plans write you a lump sum check upon diagnosis of one of these conditions. So let's say you choose $20,000 in coverage, and you are unfortunately diagnosed with one of these conditions or experience a heart attack or stroke. You get a check for that amount, and you can use that money to do whatever you'd like with. You can pay those out-of-pocket medical expenses, which I'd encourage you to do in that situation, but you can also pay utility bills, cover your mortgage, pay to fly in some family to see you while you're in the hospital, things like that, because life's expenses don't stop just because you're in the hospital, right? So that is something that has become much more popular in recent years on the Medicare side of things, to help offset kind of the sting of that high out-of-pocket maximum. So the second option is the Medigap option or Medicare supplement option. This is higher priced on a monthly basis for the plan itself, but it is a much lower risk or lower cost as you use healthcare services. So the way this works is that you keep original Medicare, right, that Part A and Part B with the government, as quite literally your health insurer. And then that 80% of major medical costs that Part A and Part B cover, great, you're good with that, but you've got the 20% that you're still on the hook for. And that's what a Medigap plan or Medicare supplement plan does for you. It takes care of the vast majority of that 20% for you. So you'd be paying $0 for your Part A, most likely, $174.70 per month for your Part B. Again, that goes up if you're in a higher income bracket. And then you add a Medigap plan. Average cost is, call it $100 to $150 per month. That varies widely based on your zip code, your gender, your age, and which type of Medigap plan you choose. But just keep that in your head, $100 to $150 in addition to the standard Part B premium. How a Medigap plan works. Basically, when Medicare decides to pay on a claim and they pay their 80%, the Medigap plan has to pay according to that. They can't decide separately from Medicare whether to pay or not. So they kind of ride the coattails of Medicare, which is good for you as the consumer. You can keep the primary benefit of original Medicare, which is there are no network restrictions. You can see any physician or facility in the U.S. that accepts Medicare, which is something like 98% of all healthcare providers in this country, which is fantastic. Really great for people who travel a lot in retirement, or people who just want ultimate choice in where they get their healthcare from without an insurance company kind of getting in the way and saying yes or no to it. So the way this boils down to it is you just pay your annual Part B deductible, which is $240 in 2024. No copays after that, no co-insurance after that. You are done with medical expenses after $240, which is pretty incredible. That is super low. So that's why you pay for what you get. When you're 65 or older, when you're getting into Medicare or starting Part B, at first, for the first 6 months of that time period, you can enroll in one of these plans without any medical questions, which is great. After that point, you would have to answer questions to hop into one of these plans or to switch them, which you can do. But just know you've got a 6-month window upon starting Medicare Part B where you can enroll in one, no questions asked. The next thing to add to this for this option of coverage is adding a separate Part D plan. So you have prescription drugs covered. These plans can be pretty inexpensive. This year, as low as 50 cents per month, depending on where you live. That won't always be the case. They tend to go up in price every year, but it is something you can get covered pretty inexpensively. Some people may push back and say, I don't take any medications. I don't need this. Fair enough. But two things to keep in mind. One, if you don't enroll in a Medicare Part D plan when you have the rest of Medicare, when you do eventually get a Part D plan, you will pay a late enrollment penalty that's permanent, which is something to be avoided for obvious reasons. Second thing is, it's great if you're healthy and you don't need medications, but in the case where you do come down with something or you need to start a drug that is very expensive and it's the only one out there that'll treat whatever you're recently diagnosed with, you need to have some sort of protection in there. And that's what even an entry-level Part D plan will take care of for you. And then something that most everybody asks about with this setup is, what about dental and vision coverage? So Medicare itself does not cover dental, vision, or hearing insurance or needs, like the routine maintenance, let's call it, the exams, the cleanings, the lenses, frames, hearing aids, Medicare doesn't cover that. So if you want that covered, you need to buy standalone coverage for that. And for starting at about $50 a month, you can get that done. And if you use pretty much any plan on the market, you use those preventive services that are most likely covered, sometimes 100%, cleanings twice a year, go get your eye exam, get your frames and lenses, contact lenses. If you use that every year, the plan is going to pay for itself in most cases. So really, those are the two options to choose from. If you leave this with anything, just knowing the differences between these two is the most important thing. So hope that was helpful. Again, if you need help further or you want some one-on-one guidance on this, contact us. Happy to help you free of charge.